Hi, this is Bob Canode coming to you on my second YouTube channel, which is Beyond the Chaos. Which, when I initially started this out, I was hoping to actually provide messages that were hopeful and actually beyond all the chaos that we've got going on in our world right now. But it turns out the best intentions of mice and men don't always play out the way you want them to. And the reason that I'm saying that is that I've been going through some health issues over the past year. And those of you who are subscribers and frequent viewers of my other channel, which is the Camp Chaos Chronicles, which has to do with race car preparation and Jaguar V12 stuff and that sort of thing. I don't want to use that channel for that purpose, to tell you what's going on in my personal life to this depth. So here's what's going on. My shop has gotten to the point where it's just kind of jammed up with things that I really need but don't use very often. And so I decided I was going to take the old milk house and turn it into the JaguarPreserve.com warehouse annex. And I was putting a roof on it. And it was in the summertime, end of July, early part of August, I believe. And began to notice that my urine was kind of brown. And so I looked it up online, and one of the first things that popped up was that if you're dehydrated, that it can manifest itself as brown urine. Okay, so I started to hydrate myself, and it got better for a while. Then eventually it got to the point where it got brown again, and then it started to get deeper brown, and then I started to get concerned. Went in for my annual physical, which I do every 3 to 5 years, whether I need to or not. And they discovered that there was a minute amount of blood in my urine. Nothing to be real concerned about, except maybe it's a good idea to get an ultrasound done and see what's going on. All right, so I did that. And it turned out that there was a mass of some kind in my bladder, and it wasn't a small one. It was about an inch, a little more than an inch in diameter, about the size of a large marble. Okay, so I got hooked up with a urologist, and he went in through the usual means that you inspect things in your bladder, and he said, "See that fluffy thing right there? Yeah. Well, that's cancer." Which kind of surprised me. Wasn't expecting that, but on October 31st, I had one procedure done where he took out most of it, and also did a dust and clean on my prostate. And then November 28th, did the rest of it, and took a biopsy of the site. And the pathology report showed that there was no malignant cells detected in the site, and my doctor responded in his notes that it was an excellent outcome. Wow, if you're going to have cancer, this is the cancer to have. Well, the plan was to, after 6 weeks or so, schedule some follow-up therapy where they take bovine tuberculosis bacteria, inject it into your bladder, you hold it there for a couple hours, and you do that for 6 weeks. And the theory is, as I understand it, that it spikes your immune system so that it will attack anything in your body, I guess, that isn't human, which is a good thing. Well, the end of January, when we were supposed to be setting up these appointments, my urine started turning brown again. But this time it got to be bloody pretty quickly. And so did an ultrasound, and not only did we find that something's happening in the bladder again, but also that there's a spot of some kind on my left kidney, which kind of makes sense since a couple weeks prior to that I had some pain in my left kidney that lasted a couple days. It wasn't severe, but it was a thing. So today what's happening is I am going in for my first MRI, where they're going to take a look at the bladder again, see what's going on. And at this point, there's a lot of blood and blood clots manifesting themselves. So we'll see what's going on there. And on Wednesday, we're going to do another one where they're going to take a look at the kidneys. The big deal, as that I perceive at this point, is what's going on with the bladder. So I get to go into the tube, a big old MRI thing, where you kind of feel like you've been buried alive. I get to do that. There's going to be medication involved. So we'll see what's going on. I'll get back to you when